Hi everyone, this is Grace the nurse, and I just played a really cool medical game. Yes, I love games, but I'm a medical nerd and a cardiology nerd, so this game basically addresses all of that. So it's called CardioEx. I pre-recorded my play because I could not figure out how to do a voiceover while playing. So anyway, here we go, CardioEx. Look how cool that is. So it's got graphics, and yeah, basically I thought it was just gonna be a cardiology game, kind of boring, but man, look at the graphics. It's got awesome music. So here I am, you have a player card. Yeah, look, I have an avatar, I'm a metal heart. So I decided today to do a diagnosis case. Basically you're going to do some tests and try to diagnose what is going on with the cardiac client. Yes, lock and load. 29-year-old male patient presents at ED after experiencing loss of consciousness. So that's LOC. So yeah, if you click on play, which I did, there you go. So there's your heart. You got 6 turns and you have to diagnose. So here it is, 29-year-old presents at ED, loss of consciousness. There's a vital signs, tachycardic. Blood pressure's good, temperature's good, satting fine, respiration's good. So let's see what's going on. So basically you get 3 action points, and yeah, to diagnose, you can pick anything. So as you can see, asking questions is 1 point. So I always like to ask questions first before I do anything. You can also perform a test, but that would be 2 points. So because he did faint, I ordered an EKG because, anyone that faints, you want to see if they have an arrhythmia. I wanted to see if this ever happened to him before. So I picked ask about previous episode. So there you go. Then you click run. All the tests are going to run. Ooh, I'm a Sherlock. Oh yeah. And there you go. So EKG shows Cove type ST segment and an inverted T wave in V1 and V2. So the EKG has ruled out 20 diseases. That's already intriguing. Cove type ST segment, T wave inversion, V1, V2. So something's happening anteriorly, but we don't know much else yet. Now I'm going to go on to the question and see how the patient answered. So has he fainted before? He's never fainted before. So anxiety has been ruled out, postural orthostatic tachycardia syndrome ruled out, and heart failure has been ruled out. So now that I used my 3 points, I'm going to go back and see if I can order more tests, ask more questions. But now I've ruled out a whole ton of diseases, and now I'm down to 5. So let's see what I have. So I got Brugada, AFib. I don't think it's AFib because the EKG did not mention any irregular rhythm. I don't think angina, maybe pericarditis. So these are basically the diagnoses that are left. I'm just gonna ask a whole bunch of other questions because I only asked 1 question, so I wanna see if he's been taking any medications. Past medical history is always important to ask too. And let's see, how about chest pain? Okay, so yeah, if he had chest pain, that could be an MI and maybe caused him to faint, although that is not one of the choices. So let's see. Oh man, no meds, no disease eliminated. Well, I tried. All right, so hopefully my second question gave me something and it didn't. So looks like he's never had any issues during exercise before that I can remember. So I think that's interesting because with Brugada syndrome, if someone, what they do is a stress test, and with Brugada syndrome, I'm gonna pause this. So I think that's interesting. So one of the possible diseases is Brugada syndrome. And anyone with Brugada syndrome, what'll happen is when they exercise, they may feel dizzy and lightheaded because what happens is usually during a stress test, your blood pressure should go up. But with Brugada syndrome, which by the way is a hereditary syndrome, it can cause very dangerous ventricular arrhythmias, which can cause sudden death. So people with Brugada syndrome, what'll happen is when they exercise, their blood pressure actually will go low, and that is one of the signs of Brugada syndrome. So anyway, back to this. So I thought that was interesting that he had mentioned no issues during exercise. So I don't know, could it be Brugada? It may be. So here we go. Let's see if he's had any chest pain. Good, no chest pain. So pericarditis, class 2 angina is ruled out. Bam! Woo, we're down to 3. But I really think it's Brugada syndrome. So now I'm gonna order more testing, see if I can really pinpoint. So I'm gonna order a stress test because yeah, with Brugada syndrome, a stress test is very important, you know, just to see, okay, with exercise, is his blood pressure going to go down? Is he gonna develop any ventricular arrhythmias? So exercise stress test, we're gonna run it and let's see what happens to our patient. Bam, here we go. Doing the stress test. And yeah, just as I thought. So exercise stress test will stop in the first minute. And yeah, patient was lightheaded pre-syncopal, and then the EKG did generate in a wide complex tachycardia, which looked like ventricular tachycardia. So absolutely AFib is ruled out, and this is consistent with Brugada syndrome. There you go. So yes, now I'm down to 2 cardiac diseases. Brugada, and I think the other one was aortic stenosis. I really think it's Brugada. So one of the ways to diagnose Brugada is an MRI or CT. And now that I look at it, I should have probably ordered a CT, but I ordered a cardiac MRI, and that's also a way to diagnose it. So cardiac MRI was normal, so AS is ruled out. So there you go, Brugada syndrome. So yes, Brugada syndrome. Yeah, I don't think I've ever had a patient who's had Brugada syndrome, but it's very interesting. So it's hereditary, and what happens is if Brugada is diagnosed, the patient will be recommended for an ICD because they're high risk of developing these dangerous ventricular arrhythmias, which can cause sudden death. Oh wow, I got 32,500, woohoo! Objectives completed. It's really cool. If you want to read more, you can click on one of the buttons and it tells you more about the cardiac condition that you diagnosed. Very, very cool case. Yeah, I love this game. So yeah, you can download this on Apple. I am not getting paid for this, but because I'm a cardiac nerd, hey, I had to play it and show you guys. So yeah, if you enjoyed this video, please check back soon for more medical game playing. Thank you very much. Bye.